Hi, my name is Adam. I first became involved with CLIC Sargent in 2010 when I was 18 years old, when I was diagnosed with Hodgkin's lymphoma whilst at university. I underwent 18 months of chemotherapy, an autologous stem cell transplant, as well as some radiotherapy. Since having the all clear, I went back to university to complete my studies, and I qualified as a dentist a few years ago now. Different cancer therapies can result in lots of different oral and/or dental complications. These can range from pain or discomfort, a dry mouth, altered taste, and these things can make things which you normally do without thinking about, like eating, talking, swallowing and drinking, a real challenge, and even quite painful in some cases. It's important to keep on top of oral hygiene during cancer treatment, and even after all the active treatment is finished. This means good, regular cleaning of your teeth and gums, regular visits to your dentist, as well as good pain relief so that you can eat, drink and swallow as comfortably as possible. So, some practical advice. Use an adult toothpaste with fluoride when brushing your teeth. Brush at least twice a day, the very last thing at night, and one other time, brushing both the teeth and the gum line. Clean in between your teeth with a floss or a special brush that's made for cleaning in between them. After you've brushed your teeth, just spit out the toothpaste. Don't rinse your mouth out with water. From about the age of 7, you can use a daily fluoride mouthwash. Again, ask your dentist about this. Reduce the amount and frequency of sugar that you're having, so not only reducing how much sugar you eat, but also, and more importantly, reduce how often you're eating sugary foods. It's a good idea to see your dentist before starting any cancer treatment. In some instances, it's better to have some dental procedures done before you start the cancer treatment. For example, in some cases where you might be getting radiotherapy to some parts of the head and neck. Usually your oncologist will already be working closely with the dental team to arrange for this, so don't be surprised if a dental assessment is part of the initial planning stages of your treatment. And if it's not, then there's no harm in asking your oncology or your own dentist if you've got any questions. Cancer and its treatment can affect your mouth in many different ways, and in some people more so than others. For example, in some cases, you'll be more susceptible to infections because your immune system can be suppressed. Your diet can also change a lot throughout treatment, and sometimes you might find yourself eating a lot more sugar or acidic foods than you usually would. And this, combined with some of the other issues like a dry mouth, can mean that dental problems such as decay or gum disease can become a problem if you don't remember to keep on top of things. Your mouth can become painful at times due to cancer therapy. For example, it's not uncommon to get mouth ulcers. Speak to your doctor or your dentist about the best pain relief for this, because it can be painful at times, like eating. Being sick isn't unusual when you're having cancer treatment, especially with chemotherapy. Your sick is very acidic, and so can cause damage to your teeth. It's important not to brush your teeth straight after you've been sick, because this can add to the damage to your teeth. It's a good idea to brush your teeth or use a fluoride mouthwash before you're sick, if you can, because this can help protect your teeth. When your cancer treatment is finished, the effects can sometimes last for some time beyond the treatment, so again it's important to keep up your regular oral hygiene, including seeing your dentist regularly. So, just some important things to remember. See your dentist regularly, before, during and after treatment. Keep your mouth clean, so brushing and flossing regularly. Reduce the amount and frequency of sugary foods and drinks. Brush your teeth before you're sick, not straight after. And if you're unsure about anything, just ask.